Hey, my name is Dr. Sam Greenblatt. I'm a psychologist that specializes in the treatment of OCD. And today, what I wanted to talk about was pornography addiction with OCD, or the overutilization of pornography. It's a topic that I see pop up very frequently in my work. Um, it's in terms of people that come to my website, it's one of the most Googled search terms. It's something that a lot of people seem to experience. And it makes sense, right? When we turn to, when we're thinking about OCD and how OCD operates, we experience very frequent distress and we experience a great urge to want to avoid the distress or do something to bring that amount of distress down. A lot of people initially might start off turning to things like alcohol or marijuana or things like that. But a lot of times these substances don't really work for folks with OCD. It kind of increases the distress that they're experiencing when they're a little drunk or high or especially hungover the next day. So people that are seeking other ways to escape the distress that they're experiencing with OCD sometimes end up turning to pornography. Porn can be something that is highly stimulating, that's very distracting, and can take your mind out of the present moment and whatever uncertainties you're wrestling with to some degree of effect. And I've treated many folks whose porn usage has ended up in the multiple hours a day sort of spectrum, and it's really kind of impeding with their ability to live their life. Now, this starts off as something that's oftentimes a slippery slope, and just like many avoidance strategies with OCD, it could end up making the OCD worse. The reason for this is kind of twofold. One, in the treatment of OCD, what we really want to do is we want to practice the ability to have kind of a bring it on mentality with the OCD, to be able to say, okay, these thoughts, these feelings, these kind of difficult, intrusive experiences are more than welcome to come. In fact, I'm going to invite them to come. With exposure therapy, we intentionally bring them up and we kind of lean into them with that kind of bring it on approach. And avoiding these challenges can allow almost our muscles to atrophy. It doesn't give us any practice in being able to sit with and tolerate the distress. And the more that we become out of practice in dealing with our intrusive thoughts in a skillful way, the harder it gets. And we end up retreating further and further back into our corner. The other thing is that OCD is kind of like a gas that fills up whatever volume that you provide it. So when we stop doing a lot of our valued activities, we put a pause on life, and we make all of these decisions around how we're going to spend our time by focusing on pornography usage. We miss out on opportunities to be living a life more aligned with our values, right? One might have a value of socializing, of learning, of creating, of exploring. And overutilizing pornography can sometimes detract from somebody's ability to really fully engage in their lives. Their lives become more and more devoted to strategies to avoid distress, and therefore the OCD content becomes more and more relevant and has more and more of a hold on the person's life and the decisions that they're making. So that's kind of one paradigm of how pornography can kind of intersect with the OCD. And the way that it's worked on in treatment is really kind of a values based learning, right? Of course, we're always going to be using the bread and butter of exposure and response prevention when we're treating OCD. If you want to learn anything more about that, you could go on my website. I have tons of literature explaining how generally that's done. Um, but in addition to that, when our lives have been really devoted to these escape behaviors or these numbing behaviors and patterns, we start to replace those patterns with things that are more aligned with our values. And it might be an initial, it might be kind of new for some clients to consider, okay, so who am I? What is important to me? How do I want to spend my time now that I'm really starting to kind of think about the way that I spend my time uh, by prioritizing the things that are important to me, things that I can move towards, rather than things that I can kind of fearfully retreat from. And that's oftentimes a very rewarding part of therapy, a very rich and fulfilling conversation to have. But of course, you need the skills to be able to tolerate the distress first, right? Porn is a strategy, it's a solution to OCD sometimes. And first, we kind of learn the alternative solutions. How do I deal with those thoughts before taking away the strategy that these folks have been already relying on? There is a second way that an overutilization of pornography can intersect with OCD, and that's when we are using porn specifically to compulse around our OCD themes. So, this is oftentimes people with sexuality themed OCDs, a fear of being gay, for example. They will sometimes frequently look at porn to try to ascertain what is the true nature of my sexuality. Am I actually gay? Am I actually straight? Right. Um, so there's many variants of sexuality themed OCDs, and with any manifestation of sexuality themed OCDs, I've worked with people that have compulsively looked at images online to try to assess the degree to which they may or may not be attracted and try to figure out their true sexuality. And with this, the approach is really bread and butter, what we do with a lot of OCD, which is recognize that these are patterns of behaviors that are really aligned to compulse, to try to achieve certainty, to try to engage in that impossible task of knowing things for sure, um, of identifying that the more that we participate in these types of behaviors, the more confused and distressed we end up being, and of recognizing that ultimately the most effective solution is going to be being able to tolerate the uncertainty, to sit with not knowing or not feeling like you know for sure, picking a rational best guess and committing to that. So, in both situations, there's an overutilization of pornography, but for different reasons. And depending on the reason that you might be overusing porn, um, that kind of identifies a different approach and a different style of working with you to reduce your pornography usage. I hope that this was helpful. If you are struggling with this, know that it is a incredibly common issue. I just don't think that's something that's spoken about enough. And if you're ever looking for further resources or therapy itself, you can check my website, links below, www.drsamgreenblatt.com. Take care.